You're listening to the Sisterhood of Limitless Living podcast. I'm your host, Dr. April Moreno. I'm a public health specialist focused on integrative wellness and autoimmune living, supporting the community of women, where I help you to live your best quality of life through being your best self-advocate. Let's get started. Hello and welcome you all to the Sisterhood of Limitless Living. If this is your first episode with us, welcome. We are a podcast that serves multicultural women on the autoimmune journey into thriving. And I'm Dr. April Moreno, and I live with autoimmune conditions as well. I also live with mental health conditions and challenges, as well as do many of us in the autoimmune community. So today I wanted to talk about this theme also as it relates to social justice, racial justice, and the work of the Sisterhood of Limitless Living. So I guess I'll start out there because this is some very interesting times. I am living for this moment. This is something we do every day. We don't do it at the protest level on a daily basis, but we do it on an inclusive level. We try to normalize. We do our part to normalize and centralize people of color's voices, women of color's voices. We do our part to not marginalize women of color in the autoimmune community, in these discussions of integrative wellness. This is our part. It is maybe a subtle part, maybe not so subtle, but it's not something that is exhausting. We do this in a way that energizes us and maintains our energy levels. I've been working in the field of racial justice, health equity, social equity, all of this for quite some time. As soon as I went to college, it was just something that I realized for the first time. Attending my first women's studies class, learning about race, class, and gender for the first time, realizing that, oh crap, I'm in all of those situations where I am not at the advantage. And this is the first time I realized this. And this answers so many questions about why I don't feel comfortable. Listeners, I went to Berkeley for my first 2 years of undergrad. And I was convinced that it was a mistake. I was convinced that I didn't belong there because I didn't have the same background. I didn't have the same upbringing as many of my classmates. I didn't have the same level of vocabulary, the same SAT scores, or even the same family and upbringing that would bring me into a situation of being at a school like Berkeley. My parents did not care if I went to college or not. In fact, my father told me not to go to college because there was so much else going on in blue-collar work that was earning so much more, where you didn't require a student loan. You don't need college. Why don't you become a flight attendant, a secretary, join the military, and you'll be fine. Don't go to college. It's a waste of money. This is family dynamics that I grew up with. My mother, on the other hand, was supportive, but not pushy about anything. So she was open to whatever I was going to do. So this is the beginning of my story into social justice and racial justice, realizing more clearly for the first time that these issues of race, class, and gender were going to be something that I would spend pretty much the rest of my life working to help. I wanted to talk really quickly about the difference between equity and equality. Equity is the reason why I was able to attend a school like UC Berkeley when I didn't have the upbringing and the training, and I didn't have the family cultivation. It wasn't as much of a conversation to be first generation. There may not have been very many first generation. I don't even know, but it wasn't even a term back then. I was very much the first generation to go to college, a 4-year college anyway. And I was lost. And to get into such a great university, I was really experiencing serious imposter syndrome. So I felt very uncomfortable being there, and I actually transferred out in my 3rd year because I was convinced still that I didn't belong there. Even though I was doing great, I did fine in my classes and my grades were good, but just knowing that I didn't have the same network or the same family upbringing. All my friends were children of doctors and engineers. My family is blue collar. My family, they were secretaries, mechanics, doing well. I mean, to the point where they didn't necessarily want me to go to college. Equity is when everyone's given an equal opportunity to something, taking into account all the other factors. For example, we think about, there's so many different drawings of the difference between equity and equality. There's one where some kids are people at a baseball game and someone's standing up and behind a wall, which I never understood the wall thing. And then there's others where there's these opportunities where we're all able to see something, whether it be in a wheelchair, so being that provision of a wheelchair, or with a ladder, that provision of a ladder or a chair, so that everyone's able to access the same information. This is equity, where something has to be done in various ways to meet certain needs so that people are able to access the same opportunities. So that is equity versus equality, where everyone's given the same thing, regardless of the background. I don't know if you've seen this drawing of the field where there's a race and there's the white man and he has nothing in front of him. He starts to run this race at the beginning. And then there's a Black woman, and in front of her, there's all these different like bikes in the road and all these different hurdles. And in many cases, a lot of people see that as equality, where we're at the same race, we're at the same beginning line, but they're not seeing all the different hazards along the path that systematically women of color are facing, especially Black women are facing, to get through into this race of life, this journey. So into thriving, into living well, and to thrive at all levels of life. So that is the difference between equality and equity, when you have to take into account these different barriers and factors that systematically, not uniquely, but systematically, intentionally have been there, historically have been there to lead to these barriers, to cause women to earn fractions on the dollar compared to a white man. So that's what I wanted to say first in terms of social justice and racial justice. The Sisterhood of Limitless Living is here for all of this. Sisterhood of Limitless Living has been here to bring the voices of women of color and representation, and to encourage diversity, bringing in allies, bringing in diverse voices, multicultural voices into this conversation of thriving and living well with autoimmune conditions. And we will continue to do this. We've done this from the beginning. It's everything we do. And I just wanted to say that first. So the second layer of this is the mental health aspect, the mental health challenge of, first of all, living in this world as a woman of color, and how challenging compared to the other challenges that women face in this world. When we think about Black women and their experiences, Breonna Taylor, we still are waiting to see justice there. And there's just many, many countless stories. And there's also Indigenous women of color going missing. So there's a lot out there. There's the women of Juarez. It just keeps going. The work we do here is specific to autoimmune living and thriving. And we will continue to do this because of the fact that in the autoimmune community, mental health is a challenge. And this is the next thing we're going to talk about today. The autoimmune community experiences all sorts of challenges in addition to the physical health challenge. There are financial implications of being on disability. I've lost several thousands of dollars because of programs I couldn't finish when I started experiencing my relapse, my diagnosis. There was so much red tape to even request a refund, to request an extension on courses I had signed up for. There's even a yoga program that they will not reimburse me for right now, even though they continue to meet without me while taking time off for being immunocompromised and on my disease modifying drugs. So there's a lot out there in terms of even missing out financially in the world as people with disability. So there's also the fact that a lot of people don't have the energy because of disability, because of pain, because of allergy, because of inflammation, because of illness, to even be able to work full time. So there's a lot there in addition to the physical health aspect. There's all these other integrative factors that we need to address. Mental health is one of them. And so today I wanted to bring up this topic of mental health. And originally this was recorded in May during Mental Health Awareness Month. But guess what? The recording accidentally deleted, unfortunately. But here we go. At least I have practice now and I'm able to refine what I've said in the past on this recording so we can continue onward and re-record it just fine. So first of all, again, mental health is something that we all experience at some level challenge. We've all experienced depression. We've all experienced some level of anxiety, some level of sadness and frustration, all these different things. But mental illness is something that we also need to address. So in the autoimmune community, a lot of us experience mental health and mental illness challenges around the time of the diagnosis, around the time of the relapse, because of the fact that we are under huge distress. We're under the cycle of acceptance. We are going through physical changes in our bodies, mentally, physiologically, we're going through a lot of changes as well. And so this does cause a lot of us in the autoimmune community to experience depression, anxiety, and things like this. Today, I wanted to bring awareness to mental health, and I wanted to talk about my experience and to help bring awareness and to help reduce stigma out there as it relates to the mental health challenge. Having an autoimmune diagnosis and the associated disability is already stigma in itself as well. Mental health is something that I believe is more common, it's more widespread, and I believe that it's something that is much more universal than the autoimmune experience. Although autoimmunity is continuing to grow in numbers, mental health is something that a lot of us can relate to as a challenge at some phase in our lives. You're going through difficult challenges, adolescence, going through, stressful encounters, stressful times, part of the human experience. And so I really wanted to bring awareness to this topic of mental health. I wanted to share my story to help bring awareness to what's going on, because my mental health journey began actually before the autoimmune experience. Mental health is something that I've been living with in terms of challenge since I was about 6 years old. And I'm in my 40s now. So when I was 6 years old, my parents divorced, and I don't think there's enough conversation about how much it impacts children. There's this really great initiative out there called ACEs Aware, at least in LA County, where they talk about adverse childhood experiences and how physicians, primary care, pediatricians are looking at identifying adverse experiences in childhood to help prevent preventable health damages out there. So it could be addiction, it could be further mental health, mental illness challenges, and things like this, because as children, we have been very vulnerable in our youth, and we are still cultivating our roots. And so as children, when people are experiencing mental health challenges, it does tend to impact our lives even more because it's now ingrained in our roots of our early development. So I'm not a psychologist, I'm not a pediatrician, but just really quickly, just to say, as we're developing our identities and we're growing up, and to be experiencing some sort of traumatic experience in early childhood or at an early age does cause further damage. So ACEs Aware, the adverse childhood experiences, these sorts of initiatives are so good as they help to prevent some level of physical health and substance abuse and other sorts of behavioral health challenges in the future. So that is their goal. That's their initiative. And I love it. It's so proactive. I really appreciate it that we're seeing how common it is that people experience these traumatic things and how important it is that we address mental health early. And so that's how I wanted to start this out. You're talking about childhood. So when I was 6, my parents got divorced. And so I just wanted to say there are so many different traumatic events out there. I mean, divorce may not be the worst, but it is something that takes the foundation away as a child. It takes away everything you've known and felt safe with. If you have 2 parents, or if you've had a parent, even just having that safety level, that safety system of support as you grow up, it's so comforting. And when that gets shaken and part of it gets broken down, there's that phrase, the broken home, it does really impact our mental health. So from there, I started to experience my first panic attacks. I started to experience dizziness. And for me, the way that I was able to, over the years, deal with the dizziness was to stare at a wall, to stare at a white wall And if you look close up at the wall at a point where you just see nothing else, you don't see the spinning anymore because you're just looking at a plain wall. You don't notice any pattern of movement. So that helped me a lot growing up. The other thing is that I grew up going to an elementary school in LA, in Chinatown. Every year we would have the lion dance. Some of the boys would be performing the lion dance. And every time those drums went on, I would have to leave the room because I would experience huge levels of panic. And so I was the only kid in my class. I would have to leave into another area to the side of the auditorium room down the hall so that I wouldn't have to hear the noise because it was very traumatic for me. And then I started to experience the feeling of not being here. And if I think about it, I feel it again, the feeling of not really being here. Like maybe I'm in a dream. So this dissociation is something I've experienced since very early on in my life. Some of it does happen to be related to other types of abuse, childhood abuse. That's how I began my childhood. Dizziness, panic attacks, feeling like I'm not really here, having to touch surfaces to make sure that it's real. Today, I still, if I think about it, I'm back there again, just the thought of it. So then mental health continues where throughout adolescence, I totally was depressed. I was very depressed, not feeling like I belonged, not feeling like I was valued as a human being, not feeling important, just really having those feelings of not mattering. Depression, anxiety, all this stuff was already there. And then it wasn't until college, and college is such an amazing awakening time for me because it just brought me into this new environment, meeting completely new people, being able to understand a lot more of social science, a lot more of what's out there in terms of analyzing culture, being able to ask those critical questions about why do we think the way we do? Why are we accepting things the way we are? College was the very first place for me to begin to do that and think critically. So from there, I started to understand the need to look at the experiences of women of color, and then later on, women with disabilities. Fast forward, I went to teach in Japan, and that was really fun. That was in the early 2000s. Had a lot of fun teaching English and then also working for a Japanese company. There were days when I would just feel very depressed, and I carried all the mental health challenges. I tried to escape by moving out of the country. So I went to live over there, but I would carry all this stuff with me all the time. Past, my childhood, all these things were constantly on my back. I was carrying them everywhere with me. I was experiencing a lot of depression. There was this one time as a student, I was studying abroad in England. I started to feel very dizzy. I actually had my first episode of vertigo. So far, my only episode of vertigo. And that was connected to stress, not knowing if my student loan was going to come through for me to go overseas. Because when you submit for financial aid in another country, it's a lot more tricky. It's not the same process as you apply for financial aid within the United States. And so it didn't go through the first time. So school was starting and I was already maybe a few days before my trip and I had this experience of vertigo. Although from there I experienced endless ringing in one of my ears as well. Going to Japan, traveling the world, I just carried this experience on my back everywhere. I couldn't resolve it. I couldn't heal it. One psychologist gave me a very good practice of mindfulness back then. And this is the beginning. This was the seed for me of visualization and mindfulness and the power of what it can do for us. So I was really dizzy. I was really, really scared and feeling very unsettled, very ungrounded. So the psychologist I went to see overseas gave me this amazing visualization exercise where I was closing my eyes, relaxing all parts of my body, visualizing a cord from the middle of my body, I believe the center of gravity, down to the core of the earth. And it was so healing. It made such a huge impact to help prevent and reduce those feelings of dizziness. That was my first experience in understanding mindfulness and guided imagery. It's very powerful and it has helped me a lot. The next huge experience happened around the time of the relapse. My first autoimmune experience, diagnosis, and all of that. That began just about 5 years ago or so. And I was working at this full-time job, where I had an abusive boss, and I had placed in my mind replaced this person or placed this pattern of an abusive interaction with someone I knew, someone I grew up with. And I was just responding to this person and acting in a place with no empowerment, feeling of being bullied. And I just saw this other person instead of my boss. I mean, they had their similarities, but I was placing this other person and making this person look like this big, scary giant. And I did the first empowering thing there. I actually left. I quit early from this job, and to celebrate, we went to Vegas. And it's frustrating because this is like the highest paying job I've had ever. And then I had to turn it down and leave. So I go to Vegas and we celebrate. But as soon as I'm in the plane, and the flight is really short, it's like less than an hour. As soon as I'm in the plane, I see the clouds below me and I freak out. I have the worst panic attack of my life. I feel like I need to get out of the plane immediately. I have never experienced this before. I was fine until that very moment. It just snuck up on me. Suddenly, I just felt like I am in this situation of complete terror. I'm frozen. I'm sweating. I want to get out of this plane. Whew. So then I go into the restroom. I don't say anything to my husband. I go in the restroom and then I sit in there and I start feeling claustrophobic. I start freaking out. I don't know if I can get out of this room. Oh my gosh. Somehow I make it out the door and head back toward my seat. And I don't know what the other passengers saw on my face, but I was just completely frozen with terror, just with this immediate panic attack that just came out of nowhere. Not exactly nowhere, knowing the amount of the months and months of stress and bullying and negative encounters I was facing all that time. So then we get off the plane. I feel like I'm in outer space for about 2 weeks. Every so often, I would have a huge panic attack throughout the day, several times a day. Every so often, I would completely just have this freak out moment, just feeling completely ungrounded, feeling like I was in outer space. I have never experienced anything like it before. Feeling completely alone, feeling like I was just not even in my own body. Somehow I got through. I mean, for the next 2 weeks, it was really scary. I was dreading getting back on the plane, all of it. And then even the hotel. Vegas has huge hotels with 20, 30 floors. And then it was even just how far we are from the elevator, this long, windy hallway, the windows that don't always open. I was just having all of this anxiety. I went to see a few different mental health counselors, mental health psychologists. The first one was not helpful at all. She saw me going through these panic attacks. I was even there with her as I was experiencing and telling her what I was going through. No answers there. The second one was listening, and that was it. She was just listening to what I was going through. She was just there to listen. There were no answers until I went to my third psychologist. I found a third one, and she was amazing. She was able to help me through understanding relaxation techniques. She brought me back into these mindfulness experiences, guided imagery. She refamiliarized me with all of these different practices. She told me to read The Biology of Belief. She talked about Louise Hay, You Can Heal Your Life. She used the therapy of EMDR, which is basically like fingers left and right. They wave them left and right in front of you, and whatever thought and memories emerge, you bring them up and you process them together. All of that was so helpful. I began to understand at this time. I was given my diagnosis with my autoimmune condition as well as I experienced my first relapse. So we've got the mental health challenge, and now we've got physical health relapse. And she was able to help me through both of those. She was living through her own autoimmune experience. She had other clients who had my condition as well. So she was just so helpful. It was just a blessing to be able to work with her. After about 3 months, she told me that I didn't need her anymore. To know that I was able to develop these tools of resilience, to understand the power of mindfulness, guided imagery, and dealing with processing negative experiences, talking through them, getting through them, developing this sense of gratitude, resilience, and self-advocacy. This helped me immensely. And from there, she just told me, you're doing great, and I don't think you even need my help anymore. I began this community, the Sisterhood of Limitless Living. I began my work in autoimmune integrative wellness coaching. I graduated with my PhD in health promotion sciences. All of this began at this time. And it was a wonderful end to this new chapter of the autoimmune experience. That's my mental health journey. It is later on tied to the autoimmune journey, especially in terms of severity. As my mental health journey got more severe, that is where the autoimmune journey began. And I wanted to share the story to help anyone else who's going through these difficulties, to provide light onto the challenges of mental health. Mental health to me is something I don't feel stigma about. Mental health to me is something that a lot of us have to experience. We all experience some level of sadness, depression, anger, disappointment. In other ways, mental illness is a situation where a lot of times it's just not going away. It doesn't necessarily have a rational explanation for, but noticing that we do carry a lot of messages. We carry a lot of experiences, difficult challenges, adverse events, negative messages that we grew up with that we have to process in order to make our daily lives brighter. I don't think it's an accident that the mental health challenge triggered the autoimmune experience, because they were there at the same time. And mental health is something that is foundational to understanding physical health, in my opinion. So that's how the Sisterhood of Limitless Living began. And a lot of it is related to the mental health journey and the power of mindfulness for healing. Getting help, seeking help, finding a good psychologist and psychiatrist if you need additional help. I had never taken medication my whole life because I felt that it was a sign of weakness. But my goodness, once I took my first prescription, I was just like, why have I struggled for all these decades when this could be taken care of so much easier with medication? One less thing to worry about. That is my story, and hopefully it helps someone who's going through the mental health struggle, and hopefully it helps you to find ways to seek out help, find ways to share your story, to voice your experience. Thank you for listening. I will close this episode with information about our upcoming workshop. I am working on a workshop with my friend Lydia Romero Johnson. She is a podcaster and a lupus survivor, lupus thriver, and she has a podcast called Lively Living with Lupus. We are collaborating on an upcoming workshop on self-care with autoimmune conditions. This is going to take place on July 1st. It's going to take place, I'll be presenting it in my Facebook group, the Sisterhood of Limitless Living. So if you're interested in learning more about self-care practices on the autoimmune journey, join us on July 1st. And the first step to do that is to join the group, the Sisterhood of Limitless Living. Search for us on Facebook, answer the questions, and I'll let you in to the group. I hope you are doing well out there, getting the care, the rest, and processing you need to get through this challenging time of the pandemic and this experience of bringing up social justice, racial justice to the forefront. Thank you for listening to this episode of the Sisterhood of Limitless Living. Follow us on iTunes or Spotify or even Podbean, where we're hosted. For more information about Dr. April Moreno, you can visit aprilmorenophd.com. Take care and have a good day.